You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you are also an interdisciplinary professional, a high-functioning leader with expertise across different fields, then you know what it's like to see opportunities that others miss. You understand the gaps in our current systems, and you have ideas about how to make things better. But sometimes having a unique perspective can feel a bit isolating, especially when it seems as though others around you aren't as excited about or as open to your ideas. You may have even felt a bit of a divide across your different disciplines or fields of expertise. I definitely understand, and it is why we've focused this podcast to provide you with the type of support that you need. On to the topic today, we're going to talk about prioritizing spending time with your ideal clients where they are actually hanging out. Let me explain. It comes up quite often when I work with clients who are building their businesses, either if they're just getting started and trying to figure out what they want to do. So we're talking about this interdisciplinary professional who's usually a mid or senior career level. They've worked in a couple of different fields over periods of time, and they really do, like I just described, see the intersectionality and the opportunities. And they have kind of formulated, they have a problem that they're going to address, or they're going to target a solution that they want to bring, but they're not quite sure who to target or where to have the discussion to kind of validate where they want to go. Or fast forward a little bit, sometimes this person has already started the business. They've been, especially in that initial phase, you're getting some work, you're doing a little bit of this, a little bit of that, and you're really wanting to kind of niche down a bit, and they're struggling to figure out kind of who to talk to. And I often teach about this. In fact, I've mentioned this multiple times on the podcast, but I think it comes up often enough and in different situations that it's a thing that needs to be repeated. But really being able to prioritize being in front of your audience, your ideal group of clients. So if you think about whoever that is, so let's say, for example, hospital system. So if hospitals are your client, the target that you want to work with, then you think about who are the decision makers in this hospital system. And if it's a group of hospitals, like large hospitals, then is it a certain position or authority? Is it a hiring manager? Is it a C-suite executive? It's who is the position, the target people making the decision about whether or not to work with you, or who would be deciding or looking for your services or the products that you offer. So if you think about who that is, then you think about where are they spending their time, and you want to hang out where they are hanging out. Okay. So if it's virtual or, an online space or an in-person space, you want to be able to figure out who these target people are and then spend some time where they're hanging out. The reason I say that is because we're essentially problem solvers, and we see this problem, we see the opportunities, we know, like I said, we have ideas about how to solve them or improve on them. And if you have not gotten your first client yet, you're really looking to validate your idea. Validating your idea means you get your first client to serve your solution to, your services. Or you are maybe looking to niche down, and you really want to see who is going to be this audience you're niching down to. So if you hang out where they are, you're looking to see who's going to, can you get new clients in this certain niche that you're looking for or that you're looking toward. So if you are thinking in terms of the best use of your energy is to kind of sift out who these people are or to go to where they are, the reason I like it so much is because when you get this group of people, let's go back to that hospital example. If it's some sort of C-suite executive and you go to healthcare administrators conference where all of these C-suite people are hanging out from all these hospitals around, like maybe a region, that's a great place to be because you're going to hear what their challenges are. Let's say it's an in-person conference. The sheer topics on the agenda will give you a really good hint about the challenges across that niche industry. But when you're spending time around them, engaging in conversation, listening and chatting, then you're going to hear them talk about those problems. If you sit in a room where there's a discussion or presentation happening around the topic, at the end of the presentation, when it's time for questions, those people get up and ask questions. And that's where you really get to hear a lot of what's going on. And then you start to insert yourself in the conversations. You can learn how to practice your elevator pitch we've talked about on this podcast. How do you introduce yourself and your services and engage in conversation? And, at first you want to listen for a while to hear what these conversations are and make note. And then you want to start to introduce yourself and your services and your perspective on the topic, because that's really important. That's an important part of engaging and getting to know someone. And you want to really have that type of communication at that level. Establish yourself as a thought leader. When you share your perspective on an issue or topic, especially look for their responses to you. Are there follow-up questions? Do they engage back with you? Are they really interested in what you have to say? Those are all in our industry going to be considered buying signs. Whether they actually work with you or not, they're interested in what you have to say. You're establishing your thought leadership. You're moving closer to that conversation about working together. Sometimes it leads to actually working with someone, and then sometimes it leads to them really understanding your perspective and what problems you solve in your business and how you are a resource, and then them connecting you with someone else in their network, which is equally rewarding and important, because if they're not your ideal client type, then they understand what you bring and then they introduce you to someone else, and your ideal client type may be in their network. But that's the sheer beauty of networking and collaborating and being in the space where your ideal client types are hanging out, because if you're finding that you're being constantly referred to someone else, you may get to where your actual ideal clients are. So maybe you thought it was the C-suite group of people, and then through a process of some conversations and things move on, you may decide that, you may identify them being a different type within this healthcare system in terms of the decision maker and your ideal client. So that's why prioritizing being in spaces where this niche group of people are hanging out, you get such a great return on that. Either you're validating that, yes, this indeed is my client type, or you're being introduced to and you're discovering who that ideal client type is, and you're getting some buy-in, and you're also getting you're exchanging clarity and being perceived as a thought leader. You're establishing that, but you're being viewed as they're getting clarity around what you do and how you work and what you offer, and being able to think of you as a resource and introduce you to more people and refer you. You'll become top of mind in other conversations they have with different people. You'd be surprised at how well this works. So I leave you with that idea. Let's back up a little bit, because I did mention that it could be social media, like online spaces, and maybe a social media platform, or this could be in person. It's equally powerful in both platforms, because you may start out in a virtual platform. And I'm going to use LinkedIn as an example. If you find yourself in conversations on LinkedIn and the conversations move at a different pace on LinkedIn, you don't want to necessarily throw all this up into someone's direct message inbox. But you may chime in on conversations, for example, posts where they're engaging, and get a really good sense and engage with people in that way. And then it could move to DM conversations, and it may ultimately move to a Zoom meeting if there's enough interest. But you can use the virtual space. There may be groups you're a part of, and you're watching the conversations and engaging in the discussions on threads in that community, and utilizing the online space to help you connect with the ideal client types as well. And then it also gives you a hint about, when you have a sense of who they are, then you can go and search and figure out what in-person conferences where, these people exist, where these people are going to be gathering. And then you can, it's a pretty good indication of like where to invest your time and energy and resources and trying to attend those in-person conferences. So that's a great way to kind of leverage that space. Another thing I'll add here is once you do decide to attend this in-person conference, then you can also leverage the virtual space to connect with attendees that are planning to attend, as well as after the conference, those that did attend that maybe you did have conversation with, or maybe you wanted to have conversation with, but didn't have the opportunity to. It's a great way to leverage both the in-person and virtual spaces. So if you're online, you want to really engage in either threads on posts, or if it's a chat feature where you can get to know people. If you're in person, those smaller or any kind of room where there's a presentation and there's time for questions, and the people that are coming up and asking questions after, just make note of who those people are so you can follow up with them. Sometimes the conversations that happen sort of in the hallway area outside of, when a presentation ends and people leave that room, they tend to gravitate in groups and chat for a little bit. That could be a great space to connect with some people and hear some conversations. And then one of my favorite places is the exhibit hall, wherever that area is, because the vendors that show up there are trying to attract the same people that you're looking to attract. So I would make note of who those vendors are and mingle. And then also the magic always seems to happen in those spaces. You bump into people, maybe you even bump into someone that you identified from a previous session that you want to follow up with, and you have a chance to introduce yourself. So I think that some really good conversations happen in the exhibit hall area that shouldn't be ignored. So your next in-person conference, just test that out. So those are some of the things that I wanted to highlight, because this came up. Well, like I said, it comes up quite often, but it was a deep dive conversation that I had with someone recently and decided that we really need to highlight this on our podcast episode. And let me kind of give you a little bit of a case study example without going, keeping the privacy and keeping it sort of anonymous. But this particular client that I'm thinking about is a practitioner, so a clinical practitioner. So she is interdisciplinary professional, senior career person in the healthcare space is where she spent the majority of her time. So in clinical practice it comes second nature to her. It's embedded. It's the way that she practices. So she is very much, kind of one-to-one in a high volume type of setting. And she has expertise in public health and is looking to, is bridging those together, has a business. And from the public health sort of consulting angle, she's really looking to leverage her thought leadership. And she's looking to build that out because she brings a very valuable voice to any conversation. And she's really looking to sit at the table where public health programs are partnering with healthcare, and appreciates the view and perspective of an interdisciplinary leader like herself with the clinical practice in healthcare as well as the public health expertise to the table to help inform the creation of programs. So she is a very uniquely designed and positioned healthcare professional and public health professional. But the challenge is that she brings this very clinical view, and it's very hard for her to see herself as a thought leader because she's used to being hands-on, moving, going in this clinical setting. And it's hard for her to see her value as a thought leader, sitting at the table, so to speak, and just sharing her thoughts. Like, she can wrap her mind around it, but it's really difficult for her to think about that ideal client type. So she's much better now, but initially when we worked together, that was very difficult for her to transition to. So now we're at a point where she is getting out more, to very strategically attending conferences and networking events that are aligned with how she has received her positioning here as a thought leader and what she wants to accomplish and who she needs to be speaking with. So for her, she was thinking about the people, the individuals that she would ultimately have an impact on, and thinking that this is where I need to be engaging because that's what her clinical side is showing her. However, I was able to get her to see, well, no, the people that you're looking to interact with are the people on this higher level of program development and decision makers at the higher organizational level to create the programs that would then serve the individuals that you're looking to kind of engage with. So it was just a different positioning because of her background But that's the beauty of this interdisciplinary field. And that's the part that most of you are feeling a little frustrated or feel like this is kind of disjointed. But from my view, I see the possibilities, and I really do see the power and like the superpowers in these intersections. So that's where I get to help kind of guide you to that positioning and making sure that you're sitting in the right spaces to attract the kind of work and connections that you really ultimately want to attract. So I hope that this has been helpful, maybe thought-provoking for some of you, maybe a few aha moments even as you're listening to this episode. As I wrap up, I'd like to remind you that I do have 2 ways to support you on your entrepreneurial journey. If you're looking for personalized guidance, like similar to what I just described, then I invite you to work for us to explore working together one-on-one. As someone who understands the unique challenges of being an interdisciplinary leader, I can help you turn your innovative ideas into reality. Or if you have established and you're really ready to join a community of high-functioning leaders like yourself, consider applying for our premium mastermind group program. You'll connect with other professionals who are, like you, bridging multiple disciplines and creating meaningful change in public health. Visit publichealthentrepreneurs.com to learn more, and the links will also be provided in the show notes. If you're looking to work with me one-on-one, you'll need to just submit a message through our website and say that you're interested in exploring that, and we'll follow up with you that way. But there's a whole page that describes the mastermind group program and a link for you to apply. So if you're interested in that, make sure that you apply so that we can follow up and meet with you and really answer all of your questions and make sure it's a really good fit. Oh my goodness, this has been really exciting for me, and I can't wait to hear some of your feedback of the aha moments and how it helped you as well. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.